So I born and brought up in Bombay, and half of my life I've been staying in Bombay, and most of my family is from Bombay. About 5 years back, I moved to Pune. Before that, so most of my schooling and college education, my undergrad, I completed from Mumbai University. After that, I moved to UK for my masters. Then I came back, then started working in Hyderabad for about 2 years with a startup. After which I moved to Pune. I still have family in Pune, and my parents have also moved in with me. And then since then I've been in. I'm a part of a medical devices startup based in Pune. So I started my own startup back in 2016, where we were funded by government, one of the grants by Government of India, Department of Biotechnology. And our intent with that particular grant was to build and design a surgical device, so to speak, a medical device which can be used intraoperatively to control a condition in women which is called postpartum hemorrhage, which usually occurs after childbirth, where the amount of blood loss that women experience is sort of uncontrollable. There are different ways to deal with it. So we designed a surgical tool to control the blood loss. So my role particularly is to take care of the clinical research bit, meaning all the inputs that are necessary to build an instrument or a device, so to speak, and then translate that bit of information into an actual product, and then go back to the clinic, test it. So that has been my role. After which, about 2 years back, I joined another startup as their innovation and strategy officer, Embryyo Technologies. And they have been essentially a part of the medical devices startup ecosystem in India for about 8 years now. And my role here is essentially to look at new products, innovation essentially in new products, and strategy as to what is it that the company can do and add value when it comes to bringing new medical devices to market. So couple of things. Back in school, I had my aunt, my mom's younger sister, who comes from computer science background, but she was a part of a government program on developing certain kinds of algorithms for bigger medical devices, such as an MRI, CT. So she was a part of a research group that worked on medical imaging. So that was sort of my first introduction to what it means. So medical devices is sort of the broad term. Medical imaging is a subsection, but a very big and important subsection when it comes to diagnostic devices, imaging in medical devices. So that was sort of my first introduction. Then my grandfather, he was my mom's father, he was a biophysicist. So as a child, I remember, so he was a professor at Pune University. So I remember visiting his office as a child, and there are a lot of fascinating things that would happen in his lab, in his cabin, interesting discussions around anatomy, physiology, application of different devices to understand how human physiology works. So that was sort of the second bit of influence. Then one of my sisters, my cousins, she's a doctor. So growing up, I had these conversations, as all of us probably do with our family, as to what is it that we want to do. So one of the biggest advice that I probably got from her is not to choose being a doctor, because it's hard, and unless that is what you absolutely want to do, it's a difficult profession to choose. So sort of that was the mix that I got in terms of inputs of, and I have always liked physiology as a science. So yeah, and sciences in general. So yeah, so that's how briefly I'd considered being a lawyer, but then eventually I switched to, okay, I want to do something in physiology and anatomy. So BSc Biotech was something that I had considered too. Then after the introduction from my aunt about what are medical devices and all of that, it was quite exciting. So then I think probably in 11th, higher secondary, I decided, okay, this is what I want to do. Because back then, biomedical as such, as a field, was not new. There were a couple of colleges that were offering that as an undergrad degree. Then I spoke to a couple of my seniors who had just started their undergrad degree in biomedical. So that was quite exciting. And then there was this one bit that was probably that was the last check on why I wanted to do biomedical. Was one of our early courses in our undergrad. We had a course in anatomy and physiology where we had to visit KM Hospital in Bombay for the entire semester to study with the students there, and it was quite cool. So we had to learn anatomy, as in there was live dissections, and professors who taught physiology came and taught us as well. So that was quite interesting, and yeah, so that's how I decided. It was sort of natural and very exciting. So he's the adventurous types. So unlike some of my friends' parents who had recommended that I choose a mainstream undergrad program like perhaps electronics or mechanical, my dad himself comes from a marine engineering background. So he understands what it means to sort of have an undergraduate course, which is a mix of, it's not like it's not like a mechanical engineering or electrical or like the mainstay of engineering. It's sort of an amalgamation of a lot of sciences. So he was primarily along with my mom, he was one of the people who sort of encouraged me by saying it's okay that the field is new, it's exciting, it will grow eventually. If this is what you want to do, go for it. The more, and he said by the time you actually finish your graduation and work for 5-6 years, there'll be enough momentum in our local ecosystem for you to be able to find the right kind of job or the opportunity, or for you to build those to be able to get where you want to go. So yeah. So one of the things that I didn't, even now, I don't really have mentors as such who are, let's say, older or more experienced in the same field. But a lot of my learning came from my peers. So it was a lot of peer-to-peer learning. And I have been a part of the Indian biotech and biomed ecosystem for about 10 years now. So it was sort of a phase where my colleagues and my friends, all of us sort of grew up in the field together, knowing what it means to build a product, what customer engagement could look like, what does it mean to sort of talk to the regulatory authorities, go in for raising funds, things like that. So a lot of skills or learnings that I have had so far have come from strong peer-to-peer learning. And all of us have sort of mix, and luckily I've been lucky to have friends and colleagues who have had complementary skills with me. So there was a lot of learning and give and take, which was interesting. So yeah. So I learned a lot from my colleagues and peers. So I'll probably list out two because they're quite interesting and very intimidating to be in that moment, but it was really nice. So one of our advisors, he's a doctor based in Pune, who at that point was also helping us with the product development bit of it, and from the perspective of a user, how would he use that particular device. So at some point the process of product development had gotten really slow, and eventually we would run out of funds to actually make that version of the product. And one day, in one of our consultations, I was sort of worried, and I didn't know how to put it. But then I told him that I don't know if this product will actually ever come out in the market, because we are sort of running out on funds, and until we raise the next round of funding or grant or whatever it is. But at this stage, the best that we can do is probably build the final version of the prototype and then see where it goes from there. So because he's also sort of a mentor for us for a while now, and one of the things that he said in that moment was really interesting. So he said, right now I'm not really worried about the product being in the market. What is important for me is to sort of engage with younger engineers to see and sort of figure out how is it that they can take these challenges in the clinical domain and find solutions for them in the form of a product, or in case of pharma background, people who develop small molecules, things like that. So he said it's okay even if this one doesn't come out, but at least you learn from this, and the next time you want to build something with me or with somebody else, you know definitely what not to do. So it's okay, you don't have to worry right away. We have like a long way to go, and probably come back to me with the same question a year after that, and then we'll see if we can do something else if we're still stuck in the same problem. So yeah, so that was quite interesting. So then that was something I had never anticipated, this fear of not having a product closure, so to speak. And then you work for something for, let's say, 3 or 4 years, and then you either your team doesn't come through, or your funds dry out, or there's not sufficient motivation, or because the product development has been so slow that there have been technologies that are far better than what you are offering, who could probably solve the problem better than what you are offering. So there are different reasons why something like this could not go ahead. So yeah, so that, but it in the process of building that product, we did add a lot of body of work in terms of literature and information and data that was actually never published. So that was something that was interesting and a good learning from him. So at first I was a little disappointed, but the way, knowing him, and as in the kind of person that he is and the tone, he is a very warm and an encouraging person to begin with. So we never took it in the sense that it was a pivot from what the original plan was, but the fact that he was encouraging enough to say that, okay, even if this X situation happens, we will still continue to work. This is probably not the goal or the expected outcome that you hoped for, but the work that you have done along the way is also useful, and we'll make sure that we can use that body of work somewhere else. So yeah, so that is something how we took it. But in general, um as you asked just now, that how difficult is it to sort of, I wouldn't say challenge, but to be upfront with people who are senior to me, in the sense where we have a mandate in place, and everybody is sort of, everybody needs to be aligned to be able to achieve that mandate. That can be hard sometimes, considering gender and age both. But we have been lucky so far, where a lot of times people who are senior than me, and probably in a different field, have politely backed down if in the event that they were not able to sort of align themselves with the mandate or the goal that we were seeking, or the short-term activity that we were seeking at that point, which has been good. It's always better when people are honest and forthcoming and say that, okay, I understand this is what you set out to do, but this is not something that I want to be a part of. And then that's better than having people who are partly committed to doing something and then it sort of gets delayed. So yeah. So right now, as such, as in terms of law, we do have a regulatory body that sort of oversees the development and marketing and sales of medical devices in the Indian ecosystem, and it's growing. And there are a lot of startups who are sort of part of this ecosystem and are building it for the better. So I'll give you a small example of what I mean by that. It's not something that I alone have to champion, but it is something that I will work towards. But there are, like I said, there are a lot of peers who are working towards it as well. So it's sort of like a group movement where everybody contributes their bit based on what is it that they are building, the category of their product, things like that. So one of the companies that I have been friends, as in the founders have been my friends for a while now, and I've been tracking their growth. So they've been a part of the Indian ecosystem for about 8-9 years now. They build devices that essentially power ventilation in pediatric population, but the ventilation process itself is manual. So they sort of tried to build a device to simplify that. They were also one of the first startups to help build a standard for such a device, because this device was relatively new. There was no Indian standard that could sort of say, okay, these are the parameters that need to be achieved, and hence, based on these parameters, a regulatory body can then regulate devices of these categories. So they have been an interesting case study for me to observe and learn from. So yeah, so like I said, there are a lot of different companies along with ours right now who are contributing to building stronger and better regulations around the development and usage of medical devices in India. So before I started the company back in 2016, a year before that, year and a half before that, I was a part of a fellowship funded by Government of India, DBT, Department of Biotechnology, and the focus of that particular fellowship was to build innovations or products essentially that could cater to the challenges within the Indian public healthcare system. So, essentially, trying to find out how do we lessen the burden of primary care services in and around different, let's say, within a taluka or a district or at a government hospital in, let's say, tier 1 cities. So, that was broadly the context to why a problem like this, because postpartum hemorrhage is a big problem in India. That was where I sort of got introduced to this particular healthcare need. And the other bit was that I wanted to work with technologies are in and around blood. Blood by itself is a very interesting physiological parameter. Even from the standpoint of research, there is a lot that we can learn about blood as a component and what it can tell you about a particular condition within a patient population, and how you could sort of monitor blood in different scenarios and different clinical conditions to come up with a diagnosis. So that was sort of my initial choice as to why I want. So addressing postpartum hemorrhage did two things. I was introduced to the problem of maternal health in general, which was quite exciting. There's a lot of problems that can be solved even now. They're difficult to sort of reach the market or even taking the product to a part where a state entity buys it and uses it for within a particular primary care center is still a challenge. But now there are a lot of devices and solutions and services that are being built by different companies, entities to address a set of challenges. So maternal and child health in general is very exciting. And DBT has been doing loads of work in trying to give away grants and supporting and mentoring different individuals, academic institutes, everybody to sort of address that build of challenge. And like I said, blood was something that is an interesting component for me to study. So trying to build a device for PPH was like a amazing combination of the two things that I wanted to do. So in that sense, I was quite lucky because I could pick, and the program manager for my fellowship was generous with all the choices that I had come up with, that these are the 10 problems that I want to address. And I think out of that, about 7 or 6 were to do with maternal health and blood. So there was the problem of addressing and diagnosing anemia. Then there is a condition where women have gestational diabetes or gestational hypertension, and diagnosing that is also a challenge in at a large scale, especially when it comes to screening. Now there are a couple of devices that do that, but back then there were not many. So then this was a problem that I chose eventually. And yes, another component was that I could actually build a device. So because my expertise is in sort of instrumentation or building a device and product development, this was sort of an amazing opportunity while all of this came together. So probably two things. One is I thought in that sense, I had two categories of things that I am still passionate about. One is elderly care or geriatric health in general, and two is maternal health. So one of the things that I think was how should I say, useful as a personal skill is to be able to have difficult conversations around women's health. That was not something, as in it comes easy to me. It's primarily because of how my parents have raised me. There was no women's health issue, or even if there's like a regular conversation around menstruation, for example, or so my parents have been super open and they never shied away from having these conversations. So for me, when I started out, uh, as in what is it that I wanted to do, I thought maternal health was an area where it was easy as for me as an individual to have these conversations and ask probably awkward questions to understand more, not from the perspective of um, not in the sense of um, a discussion, but more to understand what the problem was and from a third person perspective. So that was fairly easy for me to do. So that was one of the things why maternal health in that sense was exciting, because I could have a conversation with, we had a lot of healthcare workers coming in and all of them were women default, who would come up with their problems and then they would say things like, if it's difficult for me to talk to a male candidate who may have same questions as you, but it is difficult for us to share. So it's easy if there's a female perspective to it. It's easy for them to understand what are our problems, things like that. So that was one of the things that I thought, okay, this is something where I could help, and it's easy for me to have these conversations. The other bit was around. So when I was in college, I had read this article written by one of the professors who taught us the anatomy and physiology course, where she had written about why it means to, as in what it means to do research specifically focused around femtech devices and femtech solutions. So an interesting point that she tried to make in that article was where she said currently all, let's say for example, drug companies look at men and uh, male and female bodies as if they were same, and then or most of the times the way a solution is designed is from the perspective of that if it had to affect or cause the necessary effect, it would be from a perspective of a male body or male anatomy or male physiology. But a lot of times, lot of diseases need a differentiated approach, wherein you look at female anatomy and physiology differently, not specifically from the reproductive organ as such, but other diseases as well. For example, how do we look at cardiac health in women, or how do we look at bone health in women? So she tried to sort of put across this point where making a solution, whether it be a drug or a device or a service, needs to cater to a particular gender. So if it's a problem that you're solving in the female health category, you need to understand that female physiology works differently than male physiology. So that was something that was very interesting for me to understand that, okay, all right, even if everybody is, let's say a female is being given a blood thinner post a cardiac event, or so in that particular article she tried to highlight that even if right now we're using the same drugs, the way it will affect women is very different from how it will affect the male population, subpopulation within that study. So it's very important to take into consideration how it affects these different populations, and then look at the holistic effect of why we are providing that solution for that category. So yeah, so that was another. Now that you asked, I had never actually sat down and formally thought about it, but now that you asked me this question, this was an article that sort of is a guiding point that I have in my head, which says, okay, if you need to build a femtech solution or anything around maternal health, you need to look at it separately. It cannot be generalized with everything else around. So, living sustainably is, I think, something that needs like a holistic view. And as in, I haven't stumbled upon it, or it's how I have been brought up. And some of the things I've tried to adopt as I grew up and started living on my own. So, some of the things that we do naturally, or something that has been taught in by my mom and my parents and family as in general, has been to sort of never waste anything and reuse everything that is possible. So things like not having plastic, or using cotton bags, or making sure that, especially, so my mom takes the issue of sanitary napkins being used for menstruation very seriously. So she was one of the first people to sort of have that conversation where with me, where she said, right now these are the options that we have, but as you sort of grow older and there are different options that you can try, make sure that you seek those so as to not affect the environment because of something that you will have to do every single month. Cups and cotton sanitary napkins, which are sort of reusable. So yeah, so and that, and it's a matter of getting used to, right? Initially you're like, oh no, whether it'll work, not work, things like that. But once you're sort of used to it, I think you can make a big difference. So I think doing the small things put together as an individual, you can do a lot more. For example, one of the things that we do practice is trying to make our own homemade organic fertilizer with wet waste. So that we have been doing for a while now, and it's interesting because we have an earthworm pit. So we have pet earthworms who help us make that kind of organic fertilizer. So yeah, so like I said, there are small things that all of us can do, and it's a matter of being intentional. So with if we can do all of these small things, remembering that we are doing it for the better, I think it's easy to do. Paying it forward is something that I think is difficult and challenging for me to do. So I think one of the things that I try to do is to help people around me, as in in my immediate vicinity. So people I work with, people who work for me, who work with me, to be able to help them make those sustainable choices. And it sort of comes in different forms, right? So I'll probably give you an example. So one of the things that I would when I first moved to Pune, when I was trying to set up things here, one of the things that I would do is to sort of order groceries every 2 or 3 days. So the amount of packaging that would come with it was enormous. Then a house help of mine suggested that it's probably difficult for you to sort of have that process in place. Why don't you try um, stocking up your groceries every month, where you go and buy the whole lot, or 2 or 3 months, so that way, apart from the fresh groceries, with the amount of plastic that you sort of generate, or the waste that you generate because you want to buy something, that will get considerably reduced. So that was an interesting suggestion that I had gotten. Since then I have been trying to um, help others around me optimize small things, like having their groceries planned for a month or 2 months, and help them with making sure that they don't make a lot of waste because they're ordering something on short-term basis. The other thing that I definitely encourage doing is to do sort of nature walks. So Pune has this amazing landscape of hills and trees and a lot of greenery around. So one of the things that I do definitely and encourage others around me, as in my friends and family, is to either go on these nature walks where you're introduced to the flora around you and you know the trees and the plants of Pune in your particular ecosystem. So in a way, you know how to take care of plants around you, which is an interesting exercise to do, especially if you are interested in botany in general or just plants around you, specific to Pune as a city. And yeah, so those are the things that I think if I encourage people around me and my family and my friends to do it with me, to be able to sort of instill that one responsibility, two curiosity about natural things around you and how you can preserve them and not and affect them less as much as you can. I think that's how I look at paying it forward. But like I said, it's a difficult thing to do. But yeah, this is how I attempt to do it. I haven't done any formal mentoring as such, but I have had queries coming in from my college juniors who are currently studying biomedical, men and women both, as in younger kids, where they would have questions like, so a lot of people in the first year have this, how should I say, have probably a little doubtful if they chose the right stream. And because in engineering, we have this option where you could switch to another field in the second year if you want. So a couple of queries that I get is it worth staying in this field? Why? What will keep me motivated? Things like that. So yeah, so that is something that I probably, one of the things that I attempt is to sort of transfer that enthusiasm about medical devices in general and what it means to be a part of the medical device ecosystem in India. So that is something that I try to do. Apart from that, mentoring as such, I have had female social tech entrepreneurs come up with queries. So we within the Pune ecosystem, we have a lot of meet and greet kind of events where typically I go in as a listener, not so much as a speaker. But there, in probably group discussions and things like that, people will ask me questions around what it means to be a social entrepreneur. How do you sustain yourself while you're building devices or services or products for others, things like that. So that I have been a part of those groups, but never formally mentored anybody for a long period of time. So success, I think I look at it in a very abstract sense, but it means more than one thing to me. So I think success essentially is how you gauge an outcome of an event that you have planned or a goal that you want it done in a certain way. But more than that, I think having achieved something, it is sort of a step or a staircase to getting the next thing that you want. So it can mean a lot of things, right? It can be a way to say, okay, while trying to achieve this X thing, I have acquired all of these skills or made all of these relationships or built this network or learned a lot about myself or seen what is the worst that I can take to be able to get there and sort of make and break yourself to get there. So in that sense, I think it's like an intermediary point. So you start here, you do all of those things, you get here, but then after that, the bigger goal or the bigger picture is always something else. It's sort of like so we have this word called biomarker, which means you're trying to diagnose something else, but you use this to sort of assess the bigger situation. So I think success for me is that tiny biomarker, which is okay. If let's say in a public speaking profession, your intent as a public speaker could the way. So let's say you have had a successful event where you can do that, but your eventual intent was to reach out to as many people as you can and listen to their stories. So yes, that's how I look at success. So probably personally and professionally, I have slightly two different thoughts on that. I think personally, I would. I think it's difficult for different people to have an encouraging ecosystem to do what they want to do. But I think the attempt or the mindset that people, as in young girls, should try and develop is to sort of go for it attitude. Not in the sense that go for it from the perspective of do whatever you think is ethical, right, helps you and doesn't harm anybody else. But if that is what you really want to do, go for it. Do not, if you have people helping you along the way, be grateful, paid back, all of that, but don't stop, because self-doubt is something that is very easy to creep in. But then having said that, I think beyond that, once you're sort of over and above that phase, go for it is sort of the mantra that I would offer to younger girls in terms of personal, whatever goal that they are trying to achieve. In terms of professional, I think the everybody, I think this goes true for men and women, younger men and women, is that make sure that whatever profession that you choose, have however big or small your contribution might be to that field, take your own contribution and your ability to contribute seriously, so that and take it as a responsibility, so that you work towards it slowly, however long it takes, but you've made that small bit of contribution to a bigger field, and eventually it will help the field and others who are working in that field. So yeah, so that's sort of the two things that I would like